Dean Deolalikar, you are the founding dean of the UCR School of Public Policy since February 2013 and a professor of economics at UC Riverside since 2003. You also serve as the chair of the board of directors of the University of California Global Health Institute. Dr. Link, you are a distinguished professor of public policy and sociology at UC Riverside. Your interests are centered on topics in psychiatric and social epidemiology. Thank you both so much for joining us today.
Thank you.
Our pleasure, and at least my thank you for that generous introduction, and the my credentials sound more impressive than they really are.
No, I didn't even include the half of them. But jumping in, we have such an important topic to cover today. Our world in data currently lists that the share of people who have received at least one dose of the vaccine in low-income countries is just 1%, and lower middle-income countries are listed at only 11.8%. On the other hand, high-income countries have administered at least one dose to over 47% of their populations. There seems to be a major disparity there. Any thoughts on how this came to be, to have such a large percentage difference?
It's clear what is happening. I mean, eventually it's all a question about resources. And the rich countries of the world had the resources to buy up lots of advanced quantities, buy up in advance huge quantities of vaccine even before they were produced, and so they booked, pretty much most of the supply that was going to be coming out. They were quick, and the United States was particularly quick, and this is, credit to them for having had the foresight to buy up some of these quantities of the vaccine in advance, even before it was proven, because they had the resources to do so. And so now you have a situation where I believe a third to a half of all the currently available vaccines and currently produced vaccines in the world are under the control of the rich countries, who constitute less than 12 or 13% of the world's population. So it's a question of resources and resource allocation. Bruce?
Yeah, so this is something I study all the time, is how do we create inequalities in health? And we're remarkably adept at doing it. It keeps happening. And so every time something new happens, we discover something new or a new threat comes, in the way I think, that people, nation states, communities deploy their flexible resources. I call them flexible resources because they can be used no matter what the situation is. If it's the onset of a pandemic, it's the discovery of a new vaccine, they have these resources, and Anil mentioned these, that they deploy in that circumstance. And when they do that, they create an inequality. And that's the inequality you just told us about. Now, so the interesting thing is that keeps happening. And it's happened with chronic diseases, where disparities have been developed around those. And now it's happened around this very novel coronavirus. There were inequalities in how it went through the population. And now there's inequalities in how the distribution of the vaccines is going. So basically, we're creating a new connection between having resources and health. And this is what my whole career is kind of focused on. But one thing that's really interesting and important about this one is that when people with more resources use those resources to get a better situation for themselves, often it doesn't come back to pinch them. They just get a better situation with respect to, where they're situated with respect to pollutants. Do the diesel trucks go by their house or someone else's house? They're getting that benefit, doesn't hurt them. But this time, look out, because if we don't take care of the whole world this time, it's going to come back and pinch us. And so one of my interesting hopes is that we might learn something from this, because I think it really, in every instance, it does come back to pinch us in one way or another, the inequality, and that we'd be better off if there was less inequality. But in this instance, it's really obvious. And if we screw up, if we don't, take it really seriously and do the best we can to reduce these inequalities, it's going to hurt us, because new variants will come back, our vaccines will wear off, and they'll be there for us, and it'll be killing the old folks in our context.
I think that's a very important point that Professor Link highlighted, which which economists call externalities, and you have negative externalities here. So health and especially communicable diseases are not something that you can keep in one corner of the world. Whatever happens in Africa or China or India, as we saw the case, this was the case with the coronavirus, it spreads very quickly around the world. And so this is one place where the inequality is going to come back to bite us in the rich world. So I think we should be especially concerned of this. And by the way, another area where you sort of see this playing out, Professor Link didn't mention this explicitly, but it's there. And I think it's sort of the next big disaster calamity that the world is going to face is global warming. We have had global warming because of the cumulative impact of economic development throughout the world, but especially in the rich world. The rich world historically has contributed a large share of global warming. And now, what countries are going to be affected most by global warming? It's really going to be the poor countries that are going to pay the price. So the inequality literally spans across every dimension of life as we know it on Earth. Thanks.
Thank you both for such insightful answers. I think that was really interesting to hear both the equity portion of the question, but then also the economic portion. So my next question is kind of in the same vein, but a little bit more specific. So as of July 4th, India has over 280 million people with just one dose of the vaccine, but only 63 million with both doses, meaning fully vaccinated. In your opinion, does this indicate that they're just simply in the earlier stages of vaccine rollouts, or does this potentially indicate that there may be concerns or issues with getting and administering the second dose, since the difference between the amount of people with the first versus fully vaccinated is so wide?
Well, since I sort of probably am a little bit more familiar with the Indian situation, I'll take a first crack at it. India is sort of India's situation is somewhat ironical, because India happens to be the world's largest vaccine producer. And the largest vaccine manufacturing company in the world is based in India. And in fact, in the fall of last year, they had contracted with AstraZeneca, AstraZeneca, the vaccine that was produced. They had a licensing arrangement with them where they were going to produce over 1 billion or 2 billion doses of that vaccine. And India was actually slated to supply much of the most of the vaccines that were going to be included under this program called COVAXIN, global program to supply vaccines to poor countries at subsidized rates. And so India was going to be the center of production, and then India was going to actually supply a lot of the vaccines to the rest of the world, and they had begun doing that. But then the second wave hit India in March, April of this year, and it was especially severe. And so India had to pull back and renege on some of its commitments to COVAXIN, the global vaccine distribution agency based in Switzerland. And so India has in some ways made a mess of things. On the other hand, all those vaccines were pulled back, but they weren't deployed properly, even within India. And so the vaccine rollout in India is also bad. And again, this highlights an important aspect of how we combat pandemics in general. You need good leadership. We saw what poor leadership did in the United States through much of the pandemic in 2020. At least luckily, there was some foresight in planning for the vaccines and subsidizing the companies that would develop the new vaccines and buying up some in advance supplies of vaccines. The US showed some leadership in that area. And thanks to that, we are where we are. But in India, the leadership did not anticipate the second wave at all. And they were behaving as if they had vanquished the virus prematurely and celebrating that, India had emerged with a very low COVID count and very few COVID deaths. And then, of course, when the second wave hit India very hard in April, May, they have been scrambling to get the vaccination rollout going within India. So some of it is actually related to just poor mismanagement. It's not that India doesn't have access to vaccines. They do. You have the largest, producer of vaccines right there in India. But it's just been total mismanagement, unfortunately. Professor Link?
Well, that was such a great response. I have two things I'd say, given the fact you gave us. One thing is it makes me think about how important something I would call, coming from a school of public health infrastructure is. And that whenever you see these facts that run counter to what would be rational and reasonable about how a rollout should, you want to look at what's the nature of the public health infrastructure that should be responding to this. And it's like a signal that there's something off. And it's very unlikely that it's off just for this one thing. It's likely that you need more development. And so the inequalities in distribution by race, ethnicity, and socioeconomic status of the vaccine in our country also suggest this, problem with public health infrastructure. And the other thing the fact makes me think is, we think about medicine as being, in the body kind of. What this fact and all the other facts that are coming out with respect to our this pandemic is just how how much social sciences bear on health outcomes, because it's not people's bodies, not the syringes, it's the getting those materials to people and having them be willing and accepting. And that's a very social process. So we should always keep that in mind.
Definitely. Thank you both for your responses. I did not know India was producing or had the largest production of vaccines. So that is a very interesting facet of what we're talking about. I'd love to move on to a more...
Before we go on, Maddie, can I just add on one point that Professor Link made? He made a very important point, which is that the behavioral or demand side of vaccine acceptance is very important. And the US, we are seeing this. You had very rapid vaccine rollout, and the vaccination rates sort of increased dramatically between January and April. But after that, they have stalled because now the supply problem is no longer there. There's enough supplies of vaccines available, but there are lots of people who are reluctant to take the vaccine. In India, you are at such an early stage of the vaccine rollout that demand is right now not the problem. The problem is supply. There's just not enough vaccine supplies to make available to everyone. But at some point in India too, once you hit 60–70% vaccine coverage, you are going to see some of these demand side problems come in. That's all I wanted to add.
Thank you. And yes, I do think as the rest of the world becomes more vaccinated, that conversation will be interesting. I do have a bit of an ethical question, I suppose. Many members of the World Trade Organization, including the United States, previously blocked a push by dozens of developing countries to waive patent rights in an effort to boost production of COVID-19 vaccines for poor nations. If we could ask, what even are patent rights for those who may not know, and what does this mean for the international community that we waited until, the next question may allude to the G7 meeting when they agreed, to give a billion vaccine doses away. But I guess this goes back to the first question of we hoarded the resources in a sense before distributing them. Any thoughts on the patent right argument and why it happened this way?
This is actually Professor Ling's bailiwick, the whole issue of ethical issues surrounding intellectual property rights. And so I am going to cede the argument to him and let him start off this time.
Well, I don't know. I mean, I don't know that much about that in particular, but thinking about it through an ethical lens, I mean, I don't think we can come up with it'd be interesting to go through each one of the people that I taught their work during my ethics class. And so Anil and I just had an exchange about a very famous person who delved into ethical issues, Amartya Sen. And his approach was very practical. You have, a situation, you don't have overall principles, but you go to the situation, try to figure out the best thing in that particular situation, given the circumstance that exists there. And so, but then the way I think about it is whether or not, there's another philosopher, ethicist, his name is Peter Singers at Princeton University, who it just draws out really quickly that that our common humanity is so important, and then putting ourselves ahead because we happen to live in the United States is just, from an ethical standpoint, he would really pinch us with how wrong that is. And it's hard not to do that, but if you take his point of view, you would have to, I tell my students when we talk about him, he makes you sit on a sharp fence. You want to do this, you want to do that, and it's really, you just have to look at these issues. So there, I would hope that those kinds of ethical thoughts that people might have would push them towards pressuring our governments to be more likely to be generous with our largesse. And maybe that happened a little bit. So maybe that is a good thing.
But if I may add to that, I mean, the whole issue of intellectual property rights protecting, basically the idea here, the argument that some people have been making is that the United States and the rich countries, where most of the pharmaceutical companies that came up with the vaccines are located, should temporarily relax the patent rights associated with the vaccines that were developed against COVID. Now, that's sort of a tricky argument because, of course, the pharmaceutical companies, as you would expect, would be very much against this idea. There is also the issue that patent rights, copyrights, do spur innovation. And one reason why companies like Pfizer and Moderna and AstraZeneca came up so quickly, I mean, this is historically unprecedented that we had a vaccine from sort of the conceptual stage to the manufacturing stage, all done literally within 1 year, including 3-stage clinical trials. This is unprecedented. Normally, it takes at least 4 or 5 years for vaccines to be rolled out. And one reason why this happened was, of course, the existence of those copyrights and patent rights the companies that came up with the vaccines stood to gain a lot in terms of their profits, in terms of their shareholder value. And so if you take that away, even temporarily, does it actually reduce the incentive to innovate in the longer run? And that's sort of the debate that's been going on. But I would say there is a practical issue here that just sort of relaxing the property rights wouldn't really solve the problem, because in the poor countries, there are very few countries in the poor world, there are in the developing world, there are very few countries that have the capacity to actually manufacture these vaccines in a big way, even if they got the intellectual property rights to these vaccines. You know, the supply chain logistics issues are too complicated. Probably you have a couple of countries like India and China and Thailand that probably might be able to scale up production of vaccines, but countries in Africa and many countries in Latin America have no ability to sort of manufacture hundreds of millions or billions of doses that quickly. So I think just relaxing the intellectual property rights for a limited period would probably not have done very much, unless the pharmaceutical companies also contributed their manufacturing know-how and skills to the developing countries. That's my take on it, that sometimes I believe the patent right issue is exaggerated. The importance of that issue is exaggerated, that we sort of need really the whole, you need a whole set of infrastructure to actually manufacture these vaccines, and much of that is lacking in the poor countries. Can I, Kevin and Maddie, I'm sort of going to be a little bit bold here and usurp your authority, because I want to ask Professor Link a question. And this comes back to the point he made earlier and on which we started, the issue of resources. The rich countries have resources. They have resources that they can deploy quickly at short notice to deal with emergencies. And so they will always be well positioned to deal with any calamities or emergencies that arise. And poor countries will always be at the back of the queue. Given that a lot of these equity questions are related to resources, I would like to sort of ask Professor Link, what might be possible ways in which we could alleviate these kind of equity issues? Should we just rely on the generosity of the rich countries? Should we rely on the generosity of some rich billionaires in the rich countries like Bill Gates and Warren Buffett to do what is needed in global health? How do we rectify these health disparities in some more sustainable way, rather than just depend on the generosity of the rich countries?
Yeah, well, that's such a complicated, difficult question. And my thought about it, because it comes up all the time and when I give my spiel, as I called it earlier, about what I call fundamental causes, because it's the idea that people deploy their resources to gain a health advantage. And so what do you do about that? So, I mean, the things that are important, you can go from really broad, like we have systems, and probably Anil, you know these better than I do, that influence the distribution of resources and inequality between nations. And, you know, we often don't think about those as important to health, but then, you know, when something like this happens, we see that, oh man, they really are. And those can be either better or worse in terms of how the money flows and how much inequality there is. So we have some leverage there in terms of policies that might kind of influence inequality. The other thing is, I think you need to do something in every which way you possibly can, because if you don't, this problem is either worse or better. So if Bill Gates does something, it's not going to make it go away, but it might make it a little less bad. And you just need to do everything you possibly can at every level to try to minimize this. Well, sometimes people get discouraged because, oh, there's so much inequality. What are we going to do about that? But my answer is always, you just do everything you possibly can. But that really the fundamental thing is what is it that produces the inequality between nations, and are there systems that are alterable that would be, people could agree were fair, that would reduce that.
Yeah, no, I think that's a great point. And at least within a country, you can sort of deploy these systems or rules of the game, as it were, because governments can be a force. They're not always, but governments can be a force for sort of rectifying some of these intrinsic health disparities that arise from differential resources. And governments can do something about that through social welfare programs, through targeted health programs for the poor. But when it comes to international disparities, it's much more difficult because we don't have an international government. We don't have, we do have a United Nations, we do have global alliances, but they have very little teeth to them. They have very little enforcement teeth to them. So how do you make everyone abide by the rules of these international agencies? You can't. So I think the international sort of disparity situation is much more difficult to handle and address because of the absence of international authority that can impose some of these rules or level playing field conditions on different governments. Wouldn't you say, Bruce, would you agree with that?
Yeah, that was well said. Yeah, absolutely.
Wow. Well, I learned so much. I just want to thank you so much both for coming on this conversation, having both of you together to bounce ideas off of each other. And as Kevin said earlier, we got just such a holistic view of the international vaccine distribution and relations in general, and that it's very complicated and so much more than to consider than maybe the average person does, myself included. Yes, just thank you both. This was such a wonderful conversation.
Thank you. Thanks for inviting us.
Thanks, Maddie, and
thanks
Kevin.
for doing it with me.